Hi, I'm Susan Taylor with Scripps Health in San Diego, California. According to the American Heart Association, roughly 23% of adults in the US have varicose veins. These are veins that are visibly swollen and twisted. Joining us to talk about this is Dr. Jeffrey Weiss. He is a vascular surgeon with the Scripps Clinic Medical Group in La Jolla, California. Dr. Weiss, thanks so much for being with us.
Thank you, Susan.
So what's the function of the vein?
Well, the veins bring blood back to the heart. And while the arterial system has a heart to pump blood around, the vein makes its way back to the heart via a series of valves that stair-step the blood back towards the heart.
And so what causes these varicose veins, these veins to be swollen or twisted?
Well, the bottom line is that these valves in the veins can become dysfunctional. And when I say dysfunctional, I mean they can allow blood to go back in the reverse direction and cause the veins to engorge beyond that valve.
And who's most at risk for the varicose veins?
Well, the patients that are at risk of having these valves become dysfunctional are patients that have had lots of pregnancies, patients that have had previous blood clots, patients with a family history of varicosities, and patients that have a profession that puts them at risk, such as nursing or a waitress. Anyone who's on their feet for a prolonged period of time can develop varicose veins.
And so what's the difference between varicose veins and spider veins?
Well, a varicose vein is something you can actually see. It often protrudes, the skin sticks out, and you can see it. It's unsightly. Spider veins are in the dermis or in the skin of the patient, and they often just look kind of ugly, but they are just like they sound. It looks like a spider, little tentacles of vein that sort of spread through the skin, but it's just in the skin.
So in most cases, the varicose veins, they may not look great cosmetically, right? But they don't really cause a problem. But in some cases, actually having varicose veins is sign of a more serious problem. Talk a little bit about that.
Well, the main thing we're worried about with patients that have long-standing varicose veins is that you can end up with changes at the ankle. The skin become brown and discolored from long-standing high blood pressure, high venous blood pressure in that location. And eventually you can end up with an ulcer that can be very difficult to heal. That's the main thing we're concerned about. There's not really a risk necessarily of pulmonary embolism or a clot going to your lung. It can be a sign of some compressive effect of the veins in the pelvis. So we'd want to check that out when you're evaluated to make sure there's nothing more sinister going on. But for the most cases, it's mostly a cosmetic or it's an ache or itch that patients present with for evaluation.
So what are the signs and symptoms that you actually have a problem with these varicose veins?
So some patients present with just itching, and itching can be pretty intense. It can get worse throughout the day. Most symptoms do worsen throughout the day. You can have swelling. You can have pain. And I think pain is probably the more common complaints. Patients come in with all sorts of tingling pain, burning pain, achy pain. It can be pain at night, and they really just want some relief from those symptoms.
Is there a way to prevent getting varicose veins or to basically slow down the progression of it?
Sure. Compression hose or hosiery are the main way to do it. It's tough here in San Diego because it gets so warm, but compression hose will definitely prevent progression, and that is our mainstay of treatment. But beyond that, there are ways to treat veins beyond just wearing compression hose.
And what about elevating your legs or avoiding high heels?
Yeah, well, high heels not so much, but definitely elevating your legs will help. And avoiding situations that put your legs in a sort of a gravity dependent state, but that often is hard to do if you're working. But at night, if you elevate your legs, that will certainly help alleviate some of those symptoms.
So how do you treat these varicose veins?
So we start off with an ultrasound, and that helps us identify what the underlying problem might be. If we see that it's in a major vein, then we can treat that with a catheter-based system. A catheter is like this. This is called Claravane, and we insert this through an IV in your lower leg, and we can treat the vein in like 30 minutes, and you're back to normal activity within a day or two. The other ways we can treat it are with laser or radiofrequency ablation, which are heat-based, or Veneseal, which is glue-based. Other methods of treatment are surgery, and we can go in and remove the veins if they're large and unsightly through a series of small incisions. And then the last way we do, and probably the most common method, is with sclerotherapy. We can use ultrasound to help us guide the needle, or we can just use a vein lamp and treat the vein directly.
And the downtime for these procedures is what?
So the downtime procedure for most of the office-based procedures, which with the exception of the phlebectomy, as you mentioned, can be done within 30 minutes and you're back to normal activity really within a day or two. The phlebectomy does take a little bit more recovery because it is surgery, but usually within a couple of days, you're back to doing what you normally do.
If you've got varicose veins, when should you go see a doctor? When do you know it's time really to get these things, really checked out?
Well, I mean, really, you could have a varicose vein checked out for any reason, but I would say the most common complaint patients have is pain. And if you have pain or you have swelling or itching or something that's bothering you, you should just get it checked out to make sure it's not something more serious.
So if left untreated, doctor, what can happen?
Well, if they're untreated, first of all, I think it's a quality of life issue. People go on and they suffer with pain, itching, swelling. So there's that. And then worst case scenario is that they end up with a skin breakdown, an ulcer, and that requires months of wound care.
Any final thoughts, doctor?
Well, I would say that if you have varicose veins, you don't need to suffer. We have treatment and we're happy to assist you here anytime.
Dr. Weiss, thanks so much for being with us. We appreciate you taking the time.
Thank you, Susan.
If you want to learn more about varicose veins, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.